Hey everyone, and welcome to The Explainer. Today, we're jumping into a really common medical procedure that has huge implications for both contraception and your long-term health. It's called the bilateral salpingectomy.
So, when you hear the term permanent birth control, what comes to mind? It's a big decision, right? And what does it really mean to choose a permanent surgical option? That's kind of the big question we're starting with today, and it leads us right to our main topic.
Okay, so what are we actually talking about here? At its most basic, a bilateral salpingectomy is the surgical removal of both fallopian tubes. Simple definition, right? But there is a whole lot more to understand about why someone might choose this and what it really involves. All right, let's really get into the nitty-gritty. What does this procedure actually involve, and what makes it so different from other options out there? A few key things really define this procedure. First, that word bilateral, it just means both fallopian tubes get removed. So yes, it's a permanent form of sterilization. But here's the crucial part. The ovaries, they stay right where they are, completely untouched. And that means all their vital, hormonal functions just keep on chugging along, same as they did before the surgery. So this kind of begs the question, right? With so many different contraceptive options on the table, why would someone choose this specific surgery? Well, the reasons are actually twofold, and they're both pretty compelling. The first purpose is super straightforward. Permanent contraception. Once those fallopian tubes are gone, an egg simply can't travel to the uterus, which makes pregnancy impossible. But it's the second purpose that has really put this procedure on the map and made it so much more common. This discovery is an absolute game changer in women's health. For years and years, the assumption was that ovarian cancer started, well, in the ovaries. Seems logical, right? But now we know that many of the most aggressive types actually begin in the fallopian tubes. So think about it. When you remove the tubes, you're not just preventing pregnancy, you're literally removing the primary starting point for a very serious cancer risk. Of course, any surgery is a major decision. It's not something to be taken lightly. That's why it is so essential to weigh all the potential risks against the alternatives so you can make a truly informed choice. Making an informed choice really means looking at both sides of the coin. On one hand, you have the risks, which are similar to any surgery, things like infection or bleeding. But on the other hand, there are a lot of alternatives, from other forms of contraception all the way to a partner's vasectomy. It's all about weighing these factors and figuring out what works for you. And this right here is so important. This line, which comes directly from a consent form, really highlights a fundamental right you have as a patient. The decision is never final until the procedure actually begins. It's all about patient autonomy and feeling completely, 100% sure about your choice. So, you've made the decision. What actually happens during the surgery itself? Let's pull back the curtain and walk through the whole procedure. First off, let's talk time. A lot of people are surprised to learn just how quick this procedure is. It's what's called a minimally invasive surgery, and from start to finish, we're typically talking only about 30 to 60 minutes. That efficiency is a really key part of the process we're about to look at. The whole thing is very methodical and precise. After you get anesthesia, the surgeon makes a few tiny little incisions. They use carbon dioxide gas to gently inflate the abdomen just a bit, which gives them a clear view. Then a tiny camera, a laparoscope, is inserted. The surgeon can see everything perfectly, carefully separate and remove each fallopian tube, and then close up those small incisions. And it's also worth noting that there's another really common time this surgery is done. For anyone who is absolutely certain they're done having children, the salpingectomy can be performed right after the baby's delivered during a C-section. This combines two procedures into just one recovery period, which is pretty convenient. Okay, we've covered a lot of ground here. So as we wrap things up, let's boil it all down to the most essential points to take away from this explainer. Look, if you only take away 3 things from all this, let it be these. First, permanence. This is a permanent form of sterilization. Second, cancer risk reduction. The fact that it dramatically lowers the risk of ovarian cancer is a massive benefit. And finally, informed consent is everything. Understanding all the risks and all the alternatives is the most important part of this entire process. And that leaves us with a final thought. When we move past a vague idea of a procedure and get to a clear step-by-step understanding of what it is, why it's done, and what the alternatives are, how much does that empower us? It's a powerful reminder of why deep dives like this matter so much for our health and our autonomy. Thanks for watching.